Hi, Isabel.
Hi,
Nice to meet you.
nice to meet you.
So I will start to work on your hair, okay?
Yeah, perfect.
I will start to brush. Do you have any scalp problems, any allergies?
No allergies, no problems, nothing at all.
Okay. Sorry.
So, for what is this massage good for?
For your scalp,
Fine.
did you had a scalp massage before, a head massage?
Never. This is my first time. I'm very excited.
Okay. Okay, so I will brush it on the other side now. The Indian head massage is very popular.
I've heard about the Chinese hair massage, but I never heard about the Indian one. This is my first time.
So I got mine, the first Indian head massage, I think also this year.
Okay.
So it feels very good. Okay. You can close your eyes. Okay, you can turn your hand on this side. If it hurts, let me know.
It's all good. Thank you.
You can turn your hand a little bit more on this side. Just massage your ear. Very gentle. Okay, I will work on the other side. You can turn your head. You're doing okay?
Mm-hmm. I'm falling asleep.
Okay. Okay, so I'm gonna brush your hair one more time, and I'm gonna use some lotion for your neck, shoulders, and your back. I will do a gentle massage.
Perfect.
Okay, Isabel. So I'm going to use the lotion for your back. Your skin is very soft.
Oh, a lot of exfoliation.
The lotion smells very good. If it hurts, let me know.
Everything feels perfect.
Going to massage your scapula now. Any pain around?
No pain at all.
Okay, I'm going to work on this one.
That feels really good. Your skin looks very good. Very hydrated and
I don't see any redness or any moles or patches. Okay. I'm going to use some lotion for your arms. Just relax your arm. Okay. Okay. Okay, Isabel.
Thank you very much.
That's it for today.
Thank you.
It was a pleasure to meet you.
It was a pleasure. It was a pleasure for me. This was such a relaxing time.
I'm so happy to hear that.
Thank
so hopefully
you.
I will see you next time.
Thank you very much.
Thank you. Bye-bye.
Bye-bye.
Hi.
Hi, how are you?
Not so good today, unfortunately.
What happened?
So after a few games, if you remember that I play handball,
Yeah, I do
I
remember.
feel some tenderness on my shoulders, also on my upper back, pain mostly.
Pain.
Yeah, and also numbness in my legs. Because I
Okay.
feel very, very tired after so much effort.
Okay, and did you finish the games, the competition now?
Yeah, now yeah.
Okay. So, for how many days do you have the symptoms?
About a week now.
So, a week now.
Yeah.
Okay. So, yeah, definitely I will check your back, your legs, and I think it's maybe some muscles problems because you've been playing so much.
Yes.
And I will also check your legs for sensitivity and I will do some sensory test but if you feel this tightness on your back, so let's start with an back massage.
Okay.
And then I will take a look at your legs, okay?
Thank you.
Do you feel any pain or do you have any migraines, headaches?
Sometimes headaches.
Sometimes, okay.
Yeah.
Do you take any medications right now?
No.
No? So I will also check your scalp, your hair. I will take a look, okay, and your face.
Thank you.
So yeah, you can lay down now on your belly and I will start with the back. I will inspect
Sure.
it first, okay?
Sure.
Thank you. I'm checking your back. So you said you have some tightness on your shoulders.
Yes.
This one looks a little bit stiff here. Any pain on the spine?
Only on the upper side.
On the upper side? So
Yes.
around your neck?
Yes.
Okay. So right here we have to loosen this muscle here. But I'm going to check your spine as well. And you have no problems on your lower back, right?
No.
Okay then. So I will apply some oil and I will warm you up a little bit in case you are cold.
Okay.
So I'm so glad that you came today and hopefully you will feel better.
Me too.
So spine looks straight. I don't feel any deviations. Maybe I will just a little bit more. See your scapula. Just lift your arm a little bit. Okay. You do have a mole
Yes.
here, but looks normal. But anyway, I will check it out later. Okay, so I will put my fingers on your spine and I will drag it towards the sides. This will help also with the blood flow and circulation. And I will do the same on the other side. you warm enough?
Yes.
I'll just use my knuckles here to work on your sacrum. Okay. Let me know if you feel any pain. So I'm going to put my fingers on the spine and I will drag towards me. Perfect. So I'm going to work a little bit on your shoulders. Because I really felt the muscles here tight. And this one too. Do you feel this?
Yes.
And just relax. Sono tocca. Just wanna check the mole here. sure it's not elevated. Okay, it's round, but I don't feel it elevated. And it's not red around. That's good. Just checking your skin to make sure I don't feel any other bumps or lumps. I do have another one here, but it's kind of small. I'm not worried about it. Okay. Okay, perfect. Okay, Patricia, so I'm going to check your face now. Face is symmetric. You have a normal color. You have a rosy cheeks. Hairline has normal shape. I see a lot of baby hair. Checking your eyebrows. Do you have any pain if I do this?
No.
No? What about on your temples?
Bit, I feel tightness.
Okay. Okay, so stay with your head a little bit towards that way. Just going to check your scalp a little bit. Any itchiness?
No.
Just wanna check behind the ear as well. I don't see any dandruff. Your scalp looks pretty clean, no redness. Have a beautiful hair, it's so healthy.
Thank you.
Okay, so let's do a test to see how do you feel this
Sharp.
here.
Sharp. Sharp.
Good. And how does this feel like?
Do. 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 Also do.
Okay. So everything looks normal. Just stay now on the opposite side a little bit. I want to check your scalp first. So going to check around your ear. Here it's looking good. I don't see any dry skin or redness around. Good. So tell me, how does this feel like?
Sharp,
No.
sharp, sharp.
In this?
Dull, 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 dull.
Your hair is a little bit damaged at the ends,
Yeah.
but otherwise everything looks good. So you can come back to center now. I will tie your hair. Okay, you can relax now. Okay, Patricia, so I'm checking your leg now. You said you did feel some numbness, right?
Yeah.
So on which one?
On the right one.
On the right one?
Yes.
Okay. Going to check the temperature. They do have the same temperature, you're just a little bit cold on your toes, but they have the same temperature. I don't see any differences. Anyway, it's a little bit cold outside today.
My feet are always cold.
Are always cold.
Yeah.
And as I move up, the temperature is hotter a little bit. I do see a scar on your knee.
Yes.
You did have the surgery as well, or?
No. I fell and I didn't have anything, that's why it looks like that.
Okay. I will run a few tests on your feet and we'll check your toes as well. Okay, let's check your capillary refill. It's within 2 seconds. Okay, so just relax. Going to check every toe to see if I see something suspicious. Okay, this one looks good. Any pain?
No.
So I will do like a toe spreading to check between the toes. No eczema, no rashes so far, no dry skin. The pedal pulses are 3 plus. Okay, I'm checking this one. The same. Pedal pulses are 3 plus. So checking for any indentation of the skin to see if you are retaining any fluid, but I don't see any fluid retention. Color it's great. Okay. Okay, so I'm gonna run a few tests now. Tell me if you feel this wet.
Yes.
Do you feel this wet or dry?
Wet.
How do you feel this?
Ticklish and warm.
And do you feel it's something dry or it's something wet?
Dry.
Dry. How does this feel like now?
The same.
The same. Now?
Wet. Dry. Dry. Wet. Dry. Dry.
And does this one feel similar or the same?
This one feels softer.
So this one it's similar with a cotton ball or?
Yes. It is. It's softer, ticklish, dry.
How does this feel?
More ticklish than the other.
Now?
Also.
How does this feel?
Sharp. Sharp. Sharp.
Ticklish?
Yes. Sharp. Sharp. Dull. Dull. Dull.
And this?
Also dull. Dull. Dull.
This?
Wet. Warm and dry.
And this, do you feel it warm or cold?
Cold.
This?
Cold. 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 Sharp. 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 Dull. Dull.
How do you feel this?
Sharp.
sharp, 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 sharp.
Okay. Going to check the Babinski now. Perfect. Okay. So you did respond pretty good to the stimulus. So I'm going to apply some oil and I will try to massage your toes a little bit and your legs here, and then yeah, we're gonna discuss the findings, okay?
Okay.
Okay, so I'm gonna work on this leg a little bit because you said you had numbness on this one, right?
Yes.
And where exactly was the numbness?
Up there, right there. Yeah.
Here?
Yes.
Do you feel something now or
I do feel something warm and ticklish.
any pain?
No pain, no.
And on your toes as well, or just here?
A bit on my toes, but I guess they're fine.
And did you notice, like, when you go to sleep, do you feel better if you lay down on the bed? It's getting away.
Yes. Yeah.
When you are,
When I'm not walking, it's fine.
it's fine. Okay, I think you had too much. Also, it's stress, and
Yeah, maybe.
you did struggle these days with the competitions and everything. Just wanna check your ankles as well. Okay, Patricia. So you can dress up and yeah, we're gonna discuss the findings, okay?
Okay.
So I'm done with the exam.
Thank you so
And
much.
how do you feel your back now?
I feel so relaxed, like my back doesn't even hurt anymore.
I'm so happy about it. So I did try to release the tension from the muscles here on the shoulders, and it seems better, but we still maybe to work a little bit more.
Okay.
And everything was okay on your face, on your scalp. So I did check your toes, especially your feet. Everything looks normal. So I'm sure it was about this hard time with the stress and
Yes.
everything, the exercises that you did. So that try to relax these days
I
and
will.
stay more in the bed. And I'm sure you will feel better. If you still have any numbness on your feet, just come back and we can assess one more time, okay?
Okay, thank you so much.
Any questions?
No, and if I don't feel better, I will definitely come back.
Yeah, if you have any headaches, take some Tylenol or something over the counter,
Okay,
okay? It will help you also if you have any pain, okay?
sure.
See you next time.
See you. Thanks.
Bye-bye.
Bye.
Hi there. So, it's been a long time, right? Can you please remind me how to spell your last name? Yeah, that's what I thought. Thank you. So, any particular reason that you are here tonight? So, for your cranial nerve exam? Good. Are you taking any medications right now? No? Good. Are you allergic to anything or to any medications? Penicillin? So I'm gonna write that down. So, do you live at the same address like last time? You do. So it's 2233 North Elston, right? Good. So beside the medical questions, how do you feel? How is it going? Good. I'm happy that you are doing well. So let's begin your exam today, and I will start with the vital signs. So I'm going to put my gloves on, and I will start to check your heart first. Okay, so let's begin. Good, so I'm going to come very close to you right now. So you can close your eyes if you want and breathe normally right now. Good. Good. Now take a deep breath in, please. Exhale. Wonderful. Again. One more time, please. Good. One more time. Perfect. So I'm going to listen to your pulse now. Just relax and close your eyes. Good. So take a deep breath in now. Exhale and resist for a few seconds. Perfect. And we can do the same thing on the other side. So take a deep breath in, please. Exhale and take your breath for a few seconds. Okay, you can exhale. Okay, wonderful. So your heart rhythm is within the normal limits. I didn't hear just S1 and S2, no S3 or S4. So you are doing great so far. So I would like to take your oxygenation level. So this is going on your index finger. Good, so just stay like this for a few seconds. Perfect, so it's 98 percentile of room air and heart rate was 80. Wonderful. So next I'm going to take your temperature to make sure you don't have a fever. So I'm going to use this device and it's going inside the ears. Good. So I'm going to test this ear. So just wait a little bit. Let me see on this side as well. Okay, perfect. So it looks like you don't have a fever. I'm going to put this aside and I'm going to write down your results from the vital signs. Good. So next I'm going to check your eyes. Did you have any problems or double vision or sensitivity to light? No? Good. So let's check then your eyes. So I'm gonna come a little bit closer. I'm gonna flash this light. So yeah, try not to blink and look at me. Perfect. So now just take a look at my nose and don't move your hand. Good. So I'm going to come very close to your eye now because I want to check your pupils to see how they look. Good. They are round and reactive to light. That's perfect. So I have this object now. So follow please the object. Good. That's wonderful. So looks like your vision is intact. You have a 20/20 vision, and next I'm going to check your face, your neck. I'm going to palpate, and I'm going to check your skin as well, and I'm also going to check inside your mouth. Do you have any soreness of your throat? You do? For how many days? For 2 days. Good. So I'm going to take a look inside. First, I'm going to come a little bit closer and I'm going to touch your face right now and your neck. I'm going to palpate. your forehead. Good. I'm going to palpate now your neck to check for any inflammation of the lymph nodes. So this one on the right, it's a little bit swollen, but otherwise everything looks good. So let me check inside your mouth. I'm going to use the tongue depressor because I want to see how your throat is looking. So I'm going to use this, and stick your tongue please and say ah. Perfect. Let me take a better look. So it's a little bit irritated, not so bad though. Good. You can relax now. So I didn't see any infection. It's a little bit red, but it's not so bad. So you can use some ginger, some teas, and some syrup over the counter if you want for any inflammation. It's not so bad. I think it will go away. So also let me check your teeth and your gums. I know they've been bleeding for a while, right? So let me see. So these are a little bit red. I don't see any cavities on the upper side so far. Let me see on the lower side. I don't see any cavities, but your gums are red, and you must see an orthodontist like me. Maybe you will need some braces for your teeth on the lower side. So I know it's a little bit scary, right, to get braces, but sooner or later you will need to. So good. So let me take some notes now. So eyes 20/20 vision, I didn't see any deficiencies. So mouth looks wonderful. Throat, it's a little bit swollen, not so bad though. Teeth, they are clean, no cavities, but you might see an orthodontist. And the gums are red and they're bleeding a little bit, so first you're gonna need to see the dentist. So I can schedule you an appointment if you want for next week. Good. Otherwise, everything looked good. So also let me check your your face. Face looks a little bit dry, though it's the season, but otherwise it's clean. Beautiful. So skin, it's dry. Perfect. So I'm going to do next the hot and cold test on your face. I want to see the how you perceive the stimulus. So I'm going to use this blue ice globe. I'm going to use it on your face and tell me if you feel this hot or cold. So I'm going to use it mostly on your cheeks. It's cold, yeah. So do you think this is cold? Yeah. Okay, I'll put it on your forehead. Good. Yeah, so this is cold. Your face is a little bit red here, but I think it will go away soon. Tell me, how do you feel this? Do you feel this sharp or dull? Do you think this is dull? Good. And tell me, how do you feel it now? The same, it's dull. Wonderful. And let me touch you with this. How do you feel this? Sharp. Perfect. No. Sharp. Wonderful. How do you feel this now? Sharp. Good. Now, dull. How about now? Dull. Perfect. What about now? Yes. How do you feel this? Dull. Wonderful. So I'm also going to use these sensory brushes on your face, on your shoulders, on your chest a little bit. So tell me please if you feel my touch. Do you feel this one? Yes, good. So try to tell me where do you feel it? On your cheeks, on your forehead, where it's located, okay? You can close your eyes if you want. Perfect. Yes. Good job. Yes. Wonderful. Great. So let me write that down. So your face test sensations are, the results are very good. So everything looks awesome so far. I didn't see any problems also with your eyes. And I'm going to check also your taste and smell. And lastly, I'm going to check your ears as well. So let's begin with the smell test. Good. So I have a few tiny bottles and I also have a few scents. So I will use 2 scents and I will spray a little bit on the cotton pad. So just tell me, what do you think it is? What does this smell like? Do you think it's like fruits, like a forest. So like a forest. Actually it is. Good. So I'm going to use another scent. So you can smell. Smells wonderful. So this is mandarin and gingerbread, correct? Perfect. So I also have some tiny bottles, so please cover one of the nostril and try to smell through the other one. Wonderful. So this is apple, and I have another one right here. So try to cover now the other one and breathe. Yeah, so this is rose. Perfect. And I'm sure you will guess the last one. Yes, this is lavender. Wonderful. So looks like your smell it's intact. Good. So let's see now how is your taste. So I have something in this bottle, so please open your mouth. I will just spray a little bit. Try to identify it. It's very easy. I'm sure you will like it. And just say So yes, it's Sprite. Perfect. Good. So lastly, I'm going to check your ears to see inside your ears, and I also am going to do a hearing test. So I'm going to come very close to your ear and try to visualize the tympan membrane. So it's a little bit difficult here because you have some wax built up. So let's see on the other side. So here it's a little bit better, but you still have some wax. So I'm going to use some Q-tips for your ears. I'm going to try to clean a little bit to see if you feel better. So I'm going to come closer to your ear and good. I'm going to use another one right here. So let me take a look. Perfect. Okay, and I'm going to clean also on this side. You have just a little bit here, you have more on the other side. Good. Perfect. So I'm going to use some acupressure on your ear right now. This will help you relax. So I'm going to use it right here. Just try to close your eyes and relax. Good. So I'm going to use the acupressure on the other side as well. Just a little bit more. Okay. So let's see how is your hearing? You still have a little bit of wax here, but I didn't want to use the Q-tip very deep to make sure everything is fine. So let's see how is your hearing. So tell me if you hear this. Yes, you do? Perfect. So tell me when it stops. No? Perfect. Tell me when it stops. Wonderful. And tell me, I'm going to put this very close to your ear and tell me which one is louder, position number 1 or position number 2. So this is number 1 and this is number 2. So number 1, perfect. So this is number 1 and this is number 2. Number 1, wonderful. So I'm also going to tap on your face to make sure I'm not missing anything, so you can still close your eyes and relax. Okay, good job. So just let me check your sinuses to make sure everything is fine. Any pain when I'm touching? No? Okay, what about here? Where is your nose? No, everything is good? Alright. Good. So everything looks wonderful on your face. It's symmetric, round, very nice color of your skin. It's a little bit dry, but it's the season, so I'm not so worried about it. Good. So let's continue with the other test now. Let me write down these notes. I hope you relax and stay with me for a few more minutes until we are done. You are doing great so far. So maybe another 10 minutes, stay with me. Good. Do you have any questions in the meantime? No? Great. So let's continue. I also want to check your head a little bit, to check your scalp as well, and to check for any infestation, if you don't mind. So I'm gonna use this to check your hair a little bit, and I also see how is your scalp. I know you said it's a little bit itchy, right? So I want to make sure you don't have any infestation or some irritation. Good. So let's see this side. This one looks good. I don't see any redness. And this is clean. I don't see any dandruff as well. So let's use it on the other side. It's clean. And I'm going to check here, where are your ears, behind the ears. Yes. Good. I'm going to check on the other side, behind the ears. Yeah, so let's see. That's wonderful. Let me take a closer look. Yeah, no infestation. Everything looks perfect. And now I will put my fingers like this, and I'm going to feel if you have any bumps or lumps. So just relax and you can close your eyes if you want. Let's see behind your neck. Okay, on top. Good. Okay, so I'm going to use this brush and I will try to give you a little bit of scalp massage. So just close your eyes and relax. Good. So I'm going to use it now on the side a little bit. Just relax and close your eyes. Okay, that's very good. So, scalp looks wonderful. I didn't see any redness. That's awesome. No dandruff. So now I'm about to finish the cranial nerve exam for today, and I want you to do and to have one more test. So I'm going to say something and you need to finish the sentence to say like the last word. It's not complicated, it's very easy. We'll see. So let's see. You can close your eyes if you want and we'll begin. So 1, 2, 3, 4. What's next? 5. Good job. So close your eyes now, please. 5, 4, 3, 2, 1. What's next? 0. Awesome. And let's see one more time. 20, 21, 23, 24, 25, 26. Good job. And let's see. 10, 9, 8, 7, 6, 5. Good job. Perfect. So I'm done with the cranial nerve exam for today, and I didn't find anything abnormal. Everything is perfect. You look very good, and I just want to say that thank you so much for participating, and I hope to see you soon. Take care. Bye.